Hi, this is Dr. Lloyd White, and this video will introduce you to the upper limb and specifically look at the osteology of the upper limb and its functions. So, looking at osteology, or the bones first, most superiorly we have the clavicle and scapula. And the clavicle is the bone that is connecting the entire upper limb to the trunk. And together the clavicle and the scapula form the pectoral girdle. Attaching to the scapula we have the humerus. Then in the forearm we have the radius on the thumb side and the ulna on the little finger side. Distally, the radius will articulate with the carpal bones, of which there are 8, 2 rows. So in the first row, working from the thumb side across to the little finger, we have the scaphoid, lunate, triquetrum and pisiform. And in the distal row, another 4 bones, the trapezium, the trapezoid, the capitate and the hamate. And there are many mnemonics to help you remember the order of these bones, and the one that is typically used is some lovers try positions that they can't handle. So we have the trapezium and trapezoid, very similar names, and a good way to remember which one comes first is mum with the M and dad with the D. So mum and dad. Now the carpal bones will then articulate with metacarpals, which are at the level of the palm of the hand, and then we will have a series of phalanges making up the 5 digits. In the thumb we have 2 phalanges, a proximal and a distal, whereas in digits 2 to 5 we have a proximal, a middle and a distal. So we've looked at the bones, now let's look at the joints that these bones make where they articulate with each other. So colloquially speaking, we have the shoulder joints, the elbow joints, the wrist joints and the hand joints. But each of these are made up of potentially multiple individual joints. So in the shoulder we have 3 different joints. We have the glenohumeral, being between the scapula and the humerus, the ball and socket joint there. We have the sternoclavicular, which is where the clavicle articulates with the sternum. And we have the acromioclavicular joint, or AC joint, between the clavicle and the acromion process of the scapula. Now there's also what we consider to be a functional joint of the shoulder as well. So sternoclavicular joint and the acromioclavicular joint are the synovial joints where the movement's actually occurring, but we classify the movements at these 2 joints together into the functional scapulothoracic joint. And this is seen as just the scapula moving against the thorax or rib cage, where we can actually see the effect of the movements. Now working distally, or down the upper limb, at the elbow we have the elbow joint itself, which is the hinge joint between the humerus and the ulna. And we also have a proximal radio-ulnar joint, so between the radius and the ulna. And there's another radio-ulnar joint, the distal radio-ulnar joint, at the wrist, so again between the radius and the ulna. And the proximal and distal radio-ulnar joints tend to work together to produce the movements of supination and pronation, which is the rotational movements of the forearm to be able to change the orientation of the palms of the hand. At the wrist joint there's also other joints. We have the radiocarpal joint, so the scaphoid, the lunate and the triquetrium bones will articulate with the radius to form what we typically call the wrist joint or the radiocarpal joint. And there are also small gliding joints between the distal row of the carpals and the metacarpals, and these are our carpometacarpal joints. And moving into the hand, we have joints between our metacarpals and our proximal phalanxes called the metacarpophalangeal joints, And between digits 2 to 5, these joints are condyloid or ellipsoid in shape, and in the first digit it is a hinge. And then we also have interphalangeal joints between the phalangeal bones, and these are hinge joints to allow us to bend our fingers. It's also worth pointing out homology between the upper and the lower limbs as well, so we can get a better idea of how the upper limb functions. So because the upper and lower limbs are developing from identical patterns in the embryo, they end up having homologous components. So they start off developing the same, so in the end, in the adult, they're going to have similar features. For example, the thumb is homologous to the big toe, and the palm of the hand is homologous to the sole of the foot. So if we look at similarities between the upper and lower limb, firstly, they both attach to the axial skeleton via girdles. We have the pelvic girdle with the lower limb and the pectoral girdle in the upper limb, attaching the limb to the trunk. Proximally, we have multi-axial joints on both limbs. There's one bone in the proximal segment, which leads into a uniaxial joint, and two bones being in the distal segment. And these two bones will be connected by an interosseous membrane. The foot and the wrist will both have joint complexes, multiple joints moving together to have their function. And there will be multiple bones in both the hand and the foot. And both the feet and the hands will have 5 digits or be pentadactyl. So now to look at differences. The lower limb is weight bearing and so is dealing mostly with compressive forces, while the upper limb is non-weight bearing and so is more concerned with tensile forces of being able to hold things. The lower limb is for locomotion, whereas the upper limb is for grasping. The muscle masses of the two limbs will be different as well. Much more muscle mass in the lower limb than the upper limb, because the lower limb is responsible for locomotion. There's differences in the locations of the muscles of flexion and extension due to the rotation of the limbs during development. And the big toe is referred to as the pollex, and the thumb is referred to as the hallux, and these will have different ranges of motion as well according to their functions. Now let's look at our girdles in a little bit more detail now. So as I've mentioned, they are what are attaching the limbs to the axial skeleton or to the trunk. In yellow and blue here we have the pectoral girdle, and in green we have the pelvic girdle. Now, the pectoral girdle's role is to suspend the upper limb from the trunk, whereas the pelvic girdle's responsibility is to transfer weight to the lower limbs, and so it has to be much more robust because it is dealing with much more force. Pectoral girdle is made up of 4 bones, so 2 bones on each side, whereas the pelvic girdle just has the 2 bones, the 2 hip bones articulating with each other. Now it's important to recognise that the sacrum is not considered to be part of the girdle. The sacrum is part of the axial skeleton or vertebral column. Because of the greater range of motion in the pectoral girdle, we have 2 highly movable histological joints, which when we combine their actions together form the functional scapulothoracic joint, whereas in the pelvic girdle we have 2 histological and 2 functional joints, being the sacroiliac joint posteriorly and the pubic symphysis anteriorly. These don't allow as much movement as the upper limb due to the trade-off between mobility and stability. Pectoral girdle, as a consequence of this high mobility and reduced stability, is only connected anteriorly to the axial skeleton or to the sternum, whereas the pelvic girdle is connected both posteriorly to the sacrum and anterior to itself, forming a bony ring to help distribute that large amount of force to the lower limb. So, now, as I've mentioned already, The pectoral girdle is going to have a low degree of stability, but what it lacks in stability, it more than makes up for in mobility. So being able to then interact with the environment around us. While the pelvic girdle has a really high degree of stability, but as a consequence has a reduced amount of mobility. So this is all that trade-off between stability and mobility according to the specific functions of the limbs. So focusing a bit more on the upper limb and its functions, it's got a lot, and this is all to do with the mobility and the reduced stability. So we've got movement, reach, grasp, being able to manipulate objects and explore the environment around us, to be able to carry things and use the different segments of the upper limb as leverage to be able to lift things. We've got lots of receptors, particularly in our hands, for tactile reasons. The upper limb is also very useful for balance and is also going to be assisting with respiration, because there's a lot of muscles attaching to the upper limb that are also attaching to the thorax or the rib cage, which will help to move the rib cage as we're breathing. So thanks very much for listening and taking part in this. You can ask questions and respond to questions on the LMS, and academics will be popping in every now and then to help guide you in the right direction. Thank you very much. This has been Dr. Lloyd White. For now, bye.